Hello guys, welcome to the new question of I am your theboggusdoc and this is the CortexMedicine explaining one PYQ in one video. So today we will read about ABPA, allergic bronchopulmonary aspergillosis. Okay, the important thing is aspergillosis is separate concepted hyphae fungus. Okay, in the for the ABPA to happen, there should be predisposing factor. One is bronchial asthma, one is cystic fibrosis, and few new are added. Okay, so organisms are colonized in the airway, and ABPA is not an infection; it is an allergy reaction. Which type of allergy reaction? Type 1 more than type 3. Okay. So as you know, it is a allergy reaction. IgE will be increased. Okay, there will be inflammation. By inflammation, the lung infiltrate that will migrate, and the due to inflammation, the bronchial wall will be weakened. So there will be bronchiectasis. Okay, and as the mucus is forming, the mucus plug contain eosinophils, and there is atelectasis in the eosinophil plus production of cough. Productive cough you can say, okay, or production of sputum you can say, and there is also atelectasis. Okay, so the feature of these aspergillosis cavities are these are bilateral, featuring occurring in upper lobe, more of centrally and more of proximally. Okay, so a patient present with recurrent acute exhibition in a patient with chronic or steroid dependent asthma patient or cystic fibrosis patient, a patient that are refractory to treatment ongoing. In these patients present with fever plus productive cough is the symptom. The productive cough is usually brownish type, and there in the sound there will be crackling or clubbing that is rarely seen in 20% patient. Okay. So patient present in if a question is come in your if a patient is comes in OPD, you will diagnose by this that is a steroid dependent patient, unable still refractory to treatment patient, or recurrent acute exhibition patient that is chronic steroid dependent. You have to diagnose by this. Okay, but in the paper, a patient is a known case of known case of bronchial asthma or cystic fibrosis. Uh, should be in the question. Okay, so what should be the treatment? 12-week steroid plus airway clearance, a hypertonic saline. Okay, uh, it should be steroid dependent. If or relapse occur, then you have to give 16 week of itraconazole or voriconazole. If there is still no resolution, you have to for the omalizumab or other monoclonal antibody. Okay, so just remember how azole works. This from the micro, they inhibit the formation of fungal cell membrane. Okay, by inhibiting 14 alpha lenosterol demethylase. Okay, 14 alpha sterol demethylase. Remember this. Okay. Uh, what is new update in this? There is new the guideline we usually follow is ISHAM criteria, ISHAM guideline, and it is revised in 2024. Okay, what are the main things that are revised? Main thing revised that as essential component a patient must have to be Aspergillus fumigatus specific Ig positive. Okay, earlier the serum total Ig was more than 1000. Now it is more than 500 is also done. Other component, any two, like it is supportive, like positive IgG against switch fumigatus, blood usually count more than 500, and thin chest compared CT consistent ABPA, like bronchiectasis, mucus plugging, high attenuation mucus, or fleeting opacities on chest radiograph consistent ABPA. The high attenuation mucus plug is pathognomic, means if this is present, no sign, nothing needed. Uh, Here this is line. High attenuation mucosic pathognomy of ABPA and confirms ABPA diagnosis even if all other criteria are not fulfilled. And this is important. Second, what is important? The positive IgG against Aspergillus fumigatus. The criteria for each country or each place is different. Depends on the specific population. Like for the India, it is more than 27. याद नहीं रखना है, not to be remembered. Just that it can be changed. Okay. Serum total IgE that is more than 500 here, return that may be acceptable if all other criteria are fulfilled, and return the A Aspergillus fumigatus Ig test that is positive, that is essential can't be ignored if not present, but there should be a positive type 1 skin test is acceptable when aspergillus IG is unavailable. Okay, so thing is either aspergillus fingers IG positive or or skin test is positive. Okay, serum total Ig more than 500 should be in the question, and either positive IgG against Aspergillus fumigatus or blood eosinophil count more than 500 cells, or these any of these. Okay, remember, uh, as this is hypersensitive reaction and IgE and eosinophil is have a role. There is other antibodies that is important for this chapter is mepolizumab and benralizumab, that is interleukin 5 inhibitor, and dupilimab, that is interleukin 4 receptor alpha inhibitor. Okay, there are some hypersensitive pneumonitis that is important for us. One is farmer's lung, and the antigen is farmer's lung is thermophilic actinomyces. Okay, or bagosis, you know, by the sugar cane. Okay, uh, you can remember this as sugar cane. Okay, multiple as sugar cane. Okay, next, what is important? I don't think something important from here. Bird fancier lungs. Okay, remember by the pigeons dropping. Okay, birds dropping. Fish meal worker from nothing important. Hot tub lung, that is I think important from derma. MAP important. Okay, or I think woodworker's lung, Bacillus subtilis. This is some important. I think that are more important. The highlighted are more important. Okay, so I hope you loved this video. Thank you. Keep following. Keep spreading Cortex medicine.